Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, July 30th, and this is my daily briefing. We've had 241 cumulative positive cases in Missoula County to date. That's up 9 since yesterday. 238 of those cases were identified by testing, and 3 were epi-linked. We've had 176 recoveries and 1 death. 1 Missoula County resident and 2 non-county residents are currently hospitalized in Missoula County. We have 64 active COVID-19 cases with more than 243 close contacts. Active cases and their known contacts are in quarantine and isolation, and they'll continue to be monitored and supported as needed. The state of Montana is reporting 3,814 cumulative COVID cases, which is up 138 from yesterday. There are now 1,519 active cases with 69 active hospitalizations across the state. There have been 55 deaths related to COVID-19, which is 1 more life lost to COVID-19 since yesterday's report. Yesterday, I planted the seed for a deeper dive into some epidemiological data today, which is what I'm going to run through in this briefing. Now that we've been tracking information consistently for months, we're better able to actually see the COVID trends. Looking at data takes time, especially any health data. We need time to have a clear baseline and see the changes across time. While we have all of this data, we also know that and want to be very transparent about its limitations. All data has limitations, and it is best practice to self-disclose those limitations. Some of these limits you are well aware of because we've been talking about them this whole time. For instance, delayed test results certainly are a limitation to the data set that we currently have. It doesn't diminish the value of the data, but it still must be taken into consideration when reviewing it. I'd like to hit on a few highlights today and then invite you to take a closer look at those charts as you have time, and those are posted on our website at missoula.co/cvirus. There's a link on the right-hand side of the page. Our most recent report captures data up to and including the prior week. The report posted this week includes data from last week when we were reporting 221 cumulative cases. With that data, we can see some of the following. About 48% of those cases were reported in females and 51% were reported in males. About 51% of those cases were connected to a known case. More than 75% of the cases reported are reported within the ages ranging from 18 to 64 years of age. What's interesting is when we look more closely at COVID in Missoula County by age, it's unfortunate that at the outset of this pandemic, the message was something like COVID is an older person's problem. At that time, this is what it looked like and what early case information pointed towards. However, with more time and more cases, it became abundantly clear that COVID does not discriminate. COVID-19 can and will affect anyone at any age, and much like other respiratory diseases, those folks that are already living with pre-existing medical conditions are more at risk of contracting COVID-19 and are at more risk of having adverse outcomes if and when they are affected. If we look at the data from Missoula County, we clearly see that COVID is affecting all age demographics, but is particularly prominent among younger adults from the ages of 20 to 39 years of age. About 34% of those cases, the 221 cases up through last week, are within individuals that are 20 to 29 years of age, and about 19% of those cases are in 30 to 39-year-olds. This means that more than 50% of our local cases are in the young adult demographic. The remaining cases are distributed across younger ages from 0 to 19 and older adults from ages 50 and up. I'm reviewing this information in more detail today, not to point fingers at people or different groups of people, but to show the reality of COVID in our county. Everyone needs to continue practicing safe behaviors, keeping their social circles small, and carefully evaluating harm and minimizing the risk. Of our most recent data indicates that Missoula County has a 0.9 reproductive rate, also known as the R value. This means that for every 1 person who contracts COVID-19, they spread the virus to 0.9 people, or just under 1 person, which is really good. The goal is to keep that R number under 1. We can tell if transmission is growing or slowing based on that number, and a 0.9 tells us that we're right on the edge, riding the line between managing COVID and having COVID expand its reach here in Missoula County. For context, Western Montana, the R is at 1.3. The state of Montana is at about 1.5, and Yellowstone County, now reporting more than 500 active cases, is at 1.5. Another indicator is a positivity rating, which is a percent of the total positive tests divided by the number of tests that have been conducted. Our positivity here in Missoula County is at about 2.56. For context, Gallatin County is at about 5%. States like Arizona and Florida are between 20 and 30%. This data point helps inform decision making from reopening jurisdictions to schools or businesses. Some states are using 2% as a good positivity rating, while others are looking at 5% as their benchmark. Either way, evidence indicates that places with rates 2% and lower are in pretty good shape, and we're just over that mark. All right, I hope this information helps a bit. We continue coordinating with the University of Montana and meet routinely throughout the week in addition to weekly EPI meetings to discuss the new data. We continue keeping an eye on a lot of the data points and using that information to inform our decisions moving forward. So keep an eye on our county website at missoula.co/cvirus as we update those EPI charts weekly. We're also working on a more formal EPI presentation in the coming weeks to be delivered by our friends at the University of Montana. So that's it for my daily briefing today. Until next time, stay cool and mask up for safety. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can check out our website at missoula.co/cvirus. And you can call 258-INFO if you would like to schedule a test through our testing clinic, or if you just have general questions about COVID-19. So until Monday, everybody, stay healthy.